Hi, I'm Dr. Ed Jacobs, founder of Impact Therapy, here with Dr. Chris Schimmel, and we both teach at West Virginia University, and we go around the country doing workshops on impact therapy. And we're going to talk about one aspect of it. It's the use of a theory, rational motive behavior therapy, REBT, founded by Albert Ellis, based on the principle that thoughts cause feelings. And what I'm going to play is a role, and Chris is just going to show what she would do in counseling, and you'll see that because she's theory driven and multi-sensory, this can move pretty quickly. So it's a first session, and I'm a, say, 25-year-old guy.
Okay.
Sue Smith, remember you've counseled Sue, and she referred me to you, and she said you could help me because you really helped her.
Oh, okay.
There's Labor Day's coming up next weekend,
Mm-hmm.
and there's a picnic,
Okay.
and there's this woman that works for us, works with me. I mean, we work in the same building, and she's on the, at the other end of the hall, and I see her. And people have been telling me I should ask her out, and I want to ask her out, but I'm afraid,
kind of afraid,
real afraid, and Sue said, "Go to Chris; she'll help you."
Oh, okay. So
you helped her with.
So if
something.
I was going to ask you how I could help, it would be to get you over this fear.
I would like to ask her out.
Okay. And if we could
and they
get
even
you
said
over,
that if you could get me over this fear, then
you would ask her out, and
then I would.
And she may say no, or she may not. I mean, we don't know, but you would
well,
like to have the
even
courage.
said that she would say yes.
Okay. So I'm going to show you something here, Ed.
And note that within a minute or a minute and a half, she's up at the board already using theory, because what impact therapy says is how fast we follow a model, rapport, contract. She's got the rapport, or she sees that's easy. The contract she's clear on, so now she's starting to focus the session.
So you have a lot of fear. If I was going to say on a scale of 1 to 10, 10 is really afraid to do this, and 1 is not afraid, what would you say? What would
10.
you get? 10? Okay. So you have this fear.
I didn't date. I'm sort of a computer nerd kind of guy.
Okay.
And I dated once, or tried to ask some people out in high school, and then a couple of times in college.
So you don't have a lot of practice, and therefore you don't have a lot of confidence.
I don't have any.
Okay. Okay. Well, let me ask you a question, and this question I'm going to ask you is really going to be at the heart of what we work on here for the next 10 or 15 minutes. Where do you think that fear comes from? Or if I ask you the question, where do your feelings come from? What would you say?
I don't know.
Heart, yeah, right. A lot of people would say heart.
Yeah.
Yeah. And you know what's true about your heart? It's a pump. It's pumping blood, so it really doesn't generate your feelings. I know we're raised to think that because we say, "Oh, I have a broken heart," or I'm heart sick. But
I don't know. Where do my feelings come from?
Yeah.
I don't know. I've never thought about that.
Well, that's what I want to teach you, and this can be something that can really change a lot of aspects of your life. Your feelings, or in this case, your fear, really comes from what we call your self-talk or your thoughts. So I'm going to write that right here. Your thoughts cause your feelings. And that is super good news, because if your thoughts are causing your fear, then all we have to do is change your thoughts, and we can do what?
Change my fear.
Change your fear, right. But let me even tell you this. You have this fear going on, like you said, at a 10, on a scale of 1 to 10. That feeling of fear prevents you from asking out a woman, right? So your fear leads to no dates. Our job here today, I think, is to help you. Can I wave a magic wand and take your fear away? Probably not.
That's what I say. Sue didn't tell me about that.
Right. Well, our job really today is to get you where you have less fear. And what do you think would be a manageable amount of fear. 10 is not manageable because you get no dates.
I think below 5 maybe would cause me to ask her out.
So like a 4 or a 3? A 3 or a 4?
Okay.
So that's what we want to try to accomplish today.
And then there's people that have no fear at all. They can ask anybody out. I don't know if I don't.
And we can absolutely get you to that. But today, let's just work on reducing your fear so that you could ask this woman out. Let me ask you this. Let me show you a little bit about how this works. What are the sentences in your head? What are your thoughts? What goes through your head when you start to think about asking this woman out? What are the things that sort of get triggered in your head?
She'll say no, or she'll laugh at me,
Okay.
or she'll, I think stuff like that, and then I think if she said yes, then oh my God, what would I do on a date?
Okay.
I mean, so I'm scared every which way.
Okay. So
I never thought about it.
yeah, yeah, so I get help me figure this out. So this would be the scariest thing I've ever done, or yeah, help me figure out what goes through your head.
Well, I mean, with people, I think I don't ask
I'll look
people.
foolish?
Yeah, I'll look foolish.
Okay.
Yeah, I really do think if I ask her, God, and if she said no, I think I would, I don't know.
Let me change this. She will think what?
I'm a fool.
A fool. And that would be awful. Right, does that feel like it fits?
Yeah.
Okay, let me try another one here. You tell me if I'm not getting it right. I could not stand it if she
Said no.
said no. I couldn't stand it if she said no. She'll think I'm a fool, and that would be awful. Does that feel like what maybe goes on?
Yeah.
Okay. Wait, read that out loud for me.
She will think I'm a fool, and that would be awful. I could not stand it if she said no. I think, yeah.
Does that sort of induce
That leads
fear?
to this.
Yeah, okay. Look, watch what I'm going to write here. What did I put up here?
Not true and true.
The stuff that you're telling yourself is not necessarily grounded in fact. And when we tell ourselves stuff that isn't factual or true, it gets our feelings all in a tizzy, gets us all riled up at a 10, and then in your situation it induces fear and it leads to no potential dates, right?
Okay, we're going to stop. Let me comment on this. What you saw Chris do is use a multisensory approach. She went to a whiteboard. We advocate strongly. This is my office here, and you can see there's a big whiteboard. We advocate the use of a whiteboard or writing, even on a legal pad. She was theory-driven. So impact therapy is an active, multisensory, theory-driven approach to counseling. And you saw that with just this. She would go on and set up sentences that dispute those as they would do in REBT. But the main thing that we wanted to show was how quickly you can she got down to work really within 2 minutes because she was theory driven and she knew that making it visual would be more helpful to me than just talking to me. For more information, go to impacttherapy.com.